people know that there's a somatic,
Yeah.
and then what's the other side of the nervous system?
Visceral.
No, that's where they get confused.
Oh.
Visceral.
It's somatic and visceral.
Oh.
Okay? Somatic and visceral. Somatic has motor and sensory. Motor is going to be named muscles. Yeah?
Yeah.
So bicep, tricep, traps, all the things that you can put a name to tend to be somatic. This is, you have voluntary, all right? And in path, you'd call it skeletal or striated. Yeah?
Yeah.
This is your pain, pressure, temperature, touch.
Got it.
Okay? And that's going to be pinpointable.
You're not going to throw us out if we do it in like the middle of the exam.
Yeah, you just have a spittoon with you.
All right.
So it's pinpointable, right?
Yeah.
And it's focused. And what happens with this, it's basically goes to your primary sensory strip. Yeah,
That's your cortex. Yeah.
that's right. So there's a
Yeah.
premotor and there's a
Post.
post saturated, and there's a map over each one that maps to it from your brain, right? So this somatic side of things is the external environment. It moves you through or gets you feedback from your external world.
Yeah.
External world is out to kill you. Okay?
So you need a lot of sensory and motor to
you
get
say,
away
let's
from it.
give you a big part of the brain so you don't get us killed.
I like it.
Pay attention to the outside world because it's out to get us. This is from the internal environment. It moves things through or gives you information from.
Your inside.
That's right. So there's sensory. Well, let's do sensory and motor. Okay? The sensory side of this is not pinpointable. It's diffuse.
Hence why we have like women who have heart attacks will diffuse up into the neck, and men won't necessarily do that.
Or inferred.
Yeah. So
Inferred pain, yeah.
Referred
sorry.
pain.
Yeah,
It tends
referred
to be
pain.
referred. It tends to be not conscious control, but non-conscious.
Voluntary, and which is also in the muscle.
Okay? Make sense?
Mm-hmm.
And because it's diffuse, when we get problems with it, we go like, here, it hurts in here. Make sense?
Yeah.
So whenever people go, oh, this hurts, I'm like, ooh, crap, now I can't rule out visceral. But if they go, right here, ow, yes, that's worse. But when it's visceral, they're like, no, that doesn't make it worse. Okay? So that's where you get the referred. This is an all or none. You've probably heard that. This is not. It's a gated threshold. What's a gated threshold? All or none. There's a nerve that dumps chemical onto a cell body, and it needs a limit of 50 packets of neurotransmitter, yes, say, right? Well, to make sure that when it's stimulated here, it always fires this, it's going to drop 100 just to flood it.
Yeah.
So if it happens here, it will always pass a signal on because it's all or none.
Okay.
Yeah? Versus this one,
It has to have that threshold.
this one has one coming in and it only drops one.
Yeah.
And then you have another one activated, drops another one. And then you have another one that's on here and drops another one. So you'd need 50 of them to have a problem in order to send a signal.
Yeah.
Hence why it's so diffuse. And you don't know
Exactly.
where
It's
it
got a
comes from.
broad input area that kind of comes down and anchors onto
And
this.
then once you reach
Now it's basically hijacking this to send it to conscious control, which your somatosensory strip goes, oh, it's on our body wall over our belly. And you're like, but it's here. Right?
Because
so
it
you can't
jacked everything.
pinpoint it because you've got all this input coming from broad, diffuse areas. Okay? And you're not supposed to pay attention to it, but this is, if we get this bad, you get my attention. All right? So it's like, don't worry about us, because nobody wants to go through the world going, pump the heart, contract the vessel. Hey, how you doing? Pump the heart, move the food. All right? That would just be way too much to think about. So it says, I'm on your side. Don't worry about us. We'll keep a little connection here in the spinal cord, i.e. there's where the referral happens from a visceral sensory system to a somatic sensory system just to get your attention.
Gotcha.
I'm going to play onto your sensory map for your body wall, but really it's not the body wall that's had the problem. Okay, it's hijacking the somatic system with visceral input. And it has to reach that gated threshold before it fires. Not all or none. That's it. Okay? The motor side of the visceral system is autonomics, parasympathetics and sympathetics. These make things move. And they have three targets that are essentially this general. 1, smooth muscle. 2, cardiac muscle. And 3, glands. And these are considered antagonistic systems. This one depresses you, right? This one depresses you. This one revs you up. Fight or flight, rest and repose.
Yeah.
Kick your ass, eat and cry. Okay? What do? Well, if I want my heart to speed up, cardiac muscle gets sympathetic.
Yeah.
If I want my heart to slow down, cardiac muscle gets parasympathetic. So on the heart, they actually are antagonistic. They have
The
both
AV
feeding.
node and
That's
the
right.
SA node, yeah.
But the
those are
smooth muscle and the glands are different. They go to different populations.
and they have different movements.
So if I think about the stomach, okay, and I have smooth muscle that makes a bag or tube, basically, if the smooth muscle has blood in its lumen, then it's going to be sympathetic. If the smooth muscle bag or tube has something other than blood, I'm going to make it parasympathetic. So what makes the stomach churn your food up? Sympathetics or parasympathetics? Well, what's in your stomach? Corn, right? So, because that stuff never seems to
Turkey.
digest properly.
I knew exactly where you were with that.
Right? So what makes all that stomach churn? The smooth muscle of the stomach itself is going to be parasympathetic control because it gives peristalsis. But the blood vessels to the stomach
When they
are
dilate, you gotta
sympathetic
go.
control. Yeah?
Because you don't want to be trying to eat a burger when
Right.
you
So
get
this-
chased.
The stomach as an organ gets both sympathetics and parasympathetics, but we have them go into different populations of smooth muscle. Okay? Now I have blood vessels going everywhere. Where do I have bags and tubes that have stuff other than blood in them? Cavities. Head and neck. Not the body wall. I have no parasympathetics to my abdominal wall. But I do have them to the contents. Yeah?
Stomach, intestines, and all
That's
that.
right. Just the stuff in the, like, think of the Tupperware, right? The Tupperware is not my lunch. I don't eat it. It just contains my lunch. Same thing here. The body cavities have parasympathetics to the stuff in the cavities, not to the cavity wall. All right? Is that all right? And then glands are the same. Well, if I have a bag or tube that feeds its glandular contents into a tube or muscle that is other than blood, it's probably a parasympathetic cavity, i.e. digestion, which is why parasympathetic glands of the head and neck feed into the digestive tract. That's right. You can think pancreas, right? Digestive side of pancreas, all the enzymes that break down proteins and fat,
And the sympathetic one.
they're going to be dumped in through parasympathetics because they dump into the GI. But the glands that dump into my vascular system with all of my hormones and stuff
Genetics
cortisol
and
and
all
stuff
that.
like
are sympathetic.
So your cortisols would be more
Oh,
of
that's
the
adrenal gland, not
Yeah.
pancreas. But yes,
but that would
that's
still
right.
be the sympathetic.
Yeah, that's right. Okay.
Because you need one in order to have the other,
I
unless you
know
have a
these.
neoplasm or something like that.
So far so good. Everybody's good, right? We're good. All right, now I've got two systems to get these traveling in. I've got my central nervous system, and I've got my peripheral nervous system. I've stopped saying the short form of that. Because I have a CNS, and if I say that too loud in front of people, they think, whoa, wait a second, what are we talking about? Okay. So now we've got the central nervous system connects to the peripheral nervous system. It contains both visceral and somatic, but I only have the central nervous system is a limited access highway, right? So I have my brain, that's brain, spinal cord. Yeah? All right, when I travel down my central nervous system, I travel down inside, and I can only get out at certain spots. If I'm sympathetic, I get out between T1 and L2. Yeah? We good? Those are the only exits I have, between T1 and L2. But I'm sympathetic. What do I have to go to?
And that's it.
If I'm sympathetic, I got to go to blood vessels, and blood vessels are everywhere, so this is not going to cut it. So you set up a parallel running highway
The chain ganglia.
called the sympathetic chain. Okay? And it goes all the way around. Okay. And the one at the top is called a superior cervical ganglion. Then I have them in the neck, so I have a middle and an inferior cervical ganglion. And then I have thoracic ganglia, I have lumbar ganglia, sacral ganglia. Yeah, and then I have this one in the midline called ganglia impar, which you probably haven't talked about.
We haven't talked about these down here either. We'll forget these two. All right.
No.
No, you
No,
did that.
we've talked about them.
But we'll,
So we have a cervical chain,
yeah.
a thoracic chain,
Yeah.
a lumbar chain, and a sacral chain on both sides, which is why it's called paravertebral.
Yeah.
Okay?
But the only thing you talked about was the superior.
Well,
I
that's
just
because
looked
he's
at
doing head and neck.
slide where he like summed them all
But
up
when
on
we
a
get into
table.
the abdomen, that's when all these will
Right.
start kicking in.
But he didn't.
But that was it.
Yeah, we're not going to go.
Yeah.
We're not going to go into all the details because we're going to hit it again in thorax, abdomen.
Okay, I was about to
Yes.
say, I was like, we didn't.
Yeah, it's not
go-
details, but
I want-
enough
She's
to understand the
I know
difference.
the
Why we
Zeta,
have
but
the
I was
cervical
like,
plexus
Yeah.
here.
Right.
That's why
One
we have
side.
them. To carry the
Okay.
mass.
So, everybody
Forgot which one
so,
it's
so
in.
far so good.
So they just
Yes.
get to ride. That's
So
pretty
I'm
much-
allowed to get out at these levels.
Yeah.
Okay, this is where my prevertebral. So CNS is pre-ganglionic.
Yeah.
My PNS is a ganglia, which is post-ganglionic. Okay, so these ganglia then give off cell bodies that will go to various targets, and you'll see all those crazy diagrams that have organs all over here.
Yeah.
Right? But basically, you know, if you're up near the top, you're going to the head or neck. If you're down lower, you're probably going to go to the thorax, lungs, and heart. And if you're going down lower, you're going to go to the foregut of the stomach. And then lower, you're going to go to the midgut of the stomach. And lower, you're going to go to the hindgut, right? And then lower, you're going to go to the pelvis. And then lower, you're going to go to the lower limb. Nothing fancy. Higher you are on the chain, the higher stuff you service. Lower you're on the chain, the lower the stuff you service. But if you go to the chain, this is the bus station that takes you to the body wall. Okay? And the body wall then takes you onto nerves via gray Raymond communicans. Two spinal nerves. Yeah? That's the bus to the spinal nerves. Gray ramus communicans.
Got it.
Okay?
So it comes, if we were just following it from here, stop, just real quick. If we're following it from here, we come out through T1, L2. We go through one of our ganglion. Either, we'll start with the one that he did talk about a lot, like superior cervical ganglion. Talked about that a ton. So if we go out through our superior cervical ganglion, then we take a gray ramus communicans.
If we're going to the neck,
To the cervical
To the
plexus.
gray
spinal
ramus
nerve.
communicans, because the neck is body wall.
Got it.
If I'm going to the cranial vault, I'm going to jump onto the carotid artery,
Okay, that's where that came in. Got it. All right.
and I'm going to distribute on a vessel.
Got it,
Because
okay.
as I'm supplying the carotid artery, I'll just keep following it
I
up.
understand.
And
All
that's
right,
where you
thank
get
you.
when we talked about the deep patrols.
That's right, and I peel off of the artery
Yeah.
as the deep petrosal to go into the
Yeah.
midface to supply snotty bleeding.
Got it, okay, so you take a ride on the Grey Ramus
So that's-
Well, you take a
Communitas.
ride on the chain.
Right on the
Okay.
chain.
You
Then
come
you-
in through the T1, let's come here T1, you take a ride
Preganglionic.
pre-ganglionic, you go through your
Last stop. Got it.
You get in your chain, then you take to the last
That's right.
stop, that's the step I was, okay,
That's right,
thanks.
because you're still
And then-
preganglionic up the neck to the last gas station to the head. Got a synapse before you go to your target.
Yeah,
And you come off, if you're going to the neck, you'll come off on the Gray
Gray
Ramus
Ramus.
because that's the bus to the body wall.
yeah,
And if you're not going to the Gray Ramus, you got to take something else, and in the head they're called carotid nerve.
Plexus, yeah, the carotid.
It makes a
Carotid
plexus
plexus.
after it goes.
Yes, and it
out of
meshes
the
all
nerve.
around it.
Yeah,
Cool.
Okay. And that's all sympathetic.
all sympathetic because it's
Then-
called the sympathetic chain.
Okay.
and the other one had names, that's why I understand the other one.
That's why we
Yes.
have ganglions.
This
because
one-
But they come off.
This one I
This
don't
one
like,
is definitely the hardest.
this one does not have
Parasympathetic
names.
is
Parasympathetic is easy, because its names you already learned.
They do have
Sympathetic.
names. We just don't tell you them all.
Okay, don't worry, don't worry.
Okay? Everybody good so far?
Yeah.
Yes.
All right. Now, if you're going to the organs, because they need blood vessels too, and some of the muscle in the trachea,
Okay,
right? If I want to start a race because I'm being chased by a tiger, I want to dilate that trachea,
Oh, to get
yeah, and get more air into my
Right.
lungs, so I can do a better fight or flight.
right,
So when I take those are called splanchnics. Now, I'm not going to talk too much about them, but there's some that come off the thorax, some that come off the lumbar, and some that come off the sacral chain. Right? And
wants
you
to
can-
turn off
just like you get-
digestion, wants
That's
to
right.
turn
Just
off
like your
everything.
gas, if they're coming off as splanchnics, they might be going to the organs, foregut, midgut, hindgut, or thoracic organs, but the lower you go, they're going to go in. So
and they
as-
come off the ganglia at that point, or do they
Yeah,
go,
they don't have the synapse there.
They
okay,
just travel that way.
Okay, that's
Got
right,
it.
they're just traveling that way. They have to go not to the chain necessarily, they can do the chain, because you have two options. You can do the chain, option one is you can synapse in the chain. Option number two is you can do through the pre-aortic.
that's where pre-aortic came in, okay.
That's where pre-aortics come in. Those are your two
Right.
options. So if you're going to the body wall, oh, you're gonna synapse in the chain.
Yeah,
If you're going to the foregut, midgut, or hindgut, you're gonna go to the pre-aortics.
Which is now the plexus
Okay.
that goes around the aorta.
But essentially, you're gonna go the closest pathway to your target.
got it.
And that's all you have to do. It's like, well, what's the closest pathway to the target? Well, there's an aortic ganglia around the celiac artery, which you'll get to in the abdomen. So then you're just going to synapse there because that's the closest gas station where you want to
Gotcha.
distribute. Right? Everybody good?
Yeah,
So we'll build this more when we get to the cavities.
got it,
But splanchnic basically means viscera. It's the Greek for viscera.
got it.
So what does splanchnics do? They go to viscera.
They shut it down, rip blood away from it, cause sphincter,
That's right.
contraction and stuff like that to get it back to your muscles and your heart so you can get the hell out of there.
So I'm only allowed out of the central nervous system between T1 and L2.
Right,
That's why it's called thoraco lumbar outflow. I can come off from T1 to T12, or I can come off at L1 or L2.
so the cervical plexus that we did comes
Well,
in.
we're not ready for that
Yeah.
yet. We're not ready.
Okay,
Okay?
got it.
Now. we'll
That's
go-
your superior chain ganglion.
Yeah, that's what I-
cervical
Yeah.
ganglia.
That's all I wanted to get to here, and then I
Yep.
wanted to
Yep.
go to the cervical plexus.
Yep.
Okay.
So we'll figure out where we go.
We'll get there in a second. So we already know that sympathetics and parasympathetics supply smooth muscle, cardiac muscle, or glands.
Right.
We know that it might divide differently to glands or smooth muscle populations based on what their function on.
Blood
Blood or something other than blood. Yeah? So you can basically use that to figure out what should control something even though we haven't done it yet.
Yeah,
So the bladder has urine in it. What makes it squeeze?
parasympathetic.
Parasympathetics.
Because
make
it's not
the-
blood.
Because now it's got
Yeah.
stuff
That's
in
right.
it. Yeah.
Now there's a
Parasympathetic.
sphincter in there that
There.
will
And you
add
wouldn't want
this.
to pee while you're fight and flighting.
Yeah.
Exactly.
You want it
Makes
to
sense.
hold in there.
Yeah.
I'm just really scared.
Okay? Everybody good?
It's all about what you want to do when you're running for your life.
You don't want to crap your...
You don't want to spit.
So we have the
You
two
don't wanna-
sphincters, the two anal sphincters that are there. One's involuntary, one's voluntary.
Yeah, but we'll get to pelvis. Let's leave that for right now, okay? But that's what we're setting up.
I worked in a urology clinic, I'm all right
Yeah,
there.
so
Let's
the,
get
yeah,
rid
so
of
the
it.
ureter is a great
Yeah,
example,
great
right? What's in
example.
the urine, but what about the blood vessels to it?
Is all the
Those are gonna be sympathetically controlled smooth muscles versus the ureter itself, which peristalsis the urine down to the bladder.
Yeah.
That's gonna be
Which is where
parasympathetic. When you do those operations, you gotta be really careful not to disturb the blood supply to the ureter.
Yeah.
That's the
When we
sympathetic
do
chain
our-
that goes
When we
or
do our
sympathetic
test, we
fibers
talk
that
about
go-
whether they use peristalsis or whether they actually knew how to control their urine. Makes sense.
Okay. So that's our thoracolumbar outflow. We only allowed a T1 to L2. We make this parallel running highway with an option, chain ganglia, where you can synapse and then go to your 3 targets.
Yeah.
Or you can go around the GI tract and the aorta and then follow those major blood supplies to the GI tract, called pre-aortic. So or paravertebral
Yeah.
and pre-aortic. Sometimes called pre-aortic too, right? Or pre-vertebral,
I
sorry.
was like, wait, that's,
Yeah, so
Yeah.
they do have other names too.
Got it, cool, okay.
We ready for parasympathetics? Then we'll come back to your other ones.
Okay. We're ready for parasympathetic.
Okay, they're easy.
They're easy.
Cranial, sacral, outflow. All right.
So where do they hit?
Cranial is going to be the cat nerves.
Yep.
3 times a day, 7 days a week. Kitty has 9 lives,
10.
dead on the 10th. Those carry parasympathetics from the
7, 9.
cranial nerves. And then we have our poopers. S2, 3, 4, push poop on the floor. And that does hindgut.
Oh my goodness.
Okay, wait a minute, what did he
Pelvis.
say? He said 2, 3, 4, keep
Keeps
it
your-
off the
Yeah,
floor.
keeps it off the floor.
He was talking about
Yeah, but
another
it's
part of the body.
same concept.
This is S2, 3, 4,
You
push
were
poop
talking
on the
about
floor. This is
even
parasympathetic.
Yes,
So what controls
which is in
my
that
hindgut?
group too.
What?
What
That's
controls my
sympathetic.
hindgut? Right. This is visceral, right? This is visceral parasympathetics to the hindgut. This is going to be parasympathetics to the head, and this one
To the
Everything
body.
else.
is everything else. Okay? So we've got head, everything to the end of the midgut, and everything from the end of the midgut. Right? Cranial or sacral outflow. And that means it's coming out of the brainstem for 3, 7, 9, and 10, or it's coming out of this part of the spinal cord. Now there's another. This is the visceral sides of S2, 3, 4. There's also a
Motor.
somatic side of 2, 3, 4, and that's the one he's talking about, but that's voluntary. S2, 3, 4 pudendal nerve lifts it
Yeah.
off the floor. That's an erection. Well,
It's not as
it's more
long.
than that, but we'll leave that till pelvis. Are we good?
Yep.
All right. That's it.
That's awesome. Thank you.
We've got our nerves of the head and neck that you talked about already, right?
Yeah.
And we got that in good detail.
Yeah, so I just do this way. Okay. V1, V2, V3. The way these work is it's either 3, 7, or 9. 3 to the eye.
Yep.
7 above the corner of the mouth. 9 to the parotid. Okay. So 3 to the eye, 7, 2 branches, one above and one below the corner of the mouth, and 9
Satty,
to the
snotty.
parotid.
Spitty.
That's right. The 2 branches above the corner of the mouth is going to be greater petrosal. Below the corner of the mouth is chorda tympani.
Yep. We got those in a lot of detail.
Yep.
Yeah.
Yes.
Those we know.
So now, do you mind pulling in the cervical plexus to
Well, cervical
how
plexus
that
is
relates?
somatic.
And that's all on that side.
Right? And the only thing that it would have is something coming off of the chain a little bit that would be a gray ramus communicans to get sympathetics to the blood vessels that need to supply out for, so this is cervical. This is gonna be brachial.
Yeah.
It's gonna be lumbar,
that's why I got confused with
and it's gonna be sacral. Plexus.
Yes.
Plexuses, actually. Okay, so there's a cervical, a brachial, a lumbar, and a sacral plexus.
Yeah.
Well, all of those plexuses are actually ventral rami.
It's a motor.
Well, no, they're mixed.
Oh yeah, because they're coming
Yeah,
out.
it's a
So it's
rami.
vent mixed
It's
and
a
motor
rami.
and that mixed.
Ramis are always mixed.
Raymond's.
Yeah.
Right? So we've got a motor and a sensory part to this. Ansa cervicalis, motor part. C2, 3, 4. Transverse cervical, supraclaviculars, great auricular, lesser occipital.
Yeah.
Sensory components, but they're actually still mixed, right? Because there's going to be
Yeah.
some sympathetics coming on those things to get out to the erector pili muscles when your neck hair gets all freaked out, and to the blood vessels in your neck for the skin.
These take a ride sometimes with those? Because that's what you said, the cervical.
So yes, so autonomics in general ride on after they become postganglionic,
Ganglionic.
the gray ramus
Yep.
communicans, they'll jump onto all those nerves. I don't care which plexus you
Plexus.
talk about.
But-
There's sympathetics
okay.
involved.
They go.
Yeah.
And there's also visceral afferents following those as well to tell you what the motor side of the visceral system is up to.
for your temperature and pain and all
That's
that. Okay.
And the like the proprioception and like where you're
Yeah.
at.
My body knows
Where I'm at.
how much pressure my ulnar artery's under, but I don't. Because
Or
I
how
don't want
much
to have
you
to
cry.
think about that. That's on my team.
Is that why you don't feel JVD? Like a lot of people they say when they see it, like they'll feel like a little bit of pressure, but it's not as like.
Yeah, there's a certain
Largest.
amount of that, but if you drink so much coffee that you all of a sudden start going, oof, my heart is racing, you can feel that because you're reaching the threshold that kind of starts giving you like, ooh, that doesn't feel right.
So I guess this is, the reason I brought up it in the first place was because I was looking, when I was having trouble connecting the body, what we saw, to what we talked about in class. So we never truly talked about the cervical plexus in class, yet then we went to it in the body. So we talked
You guys
about,
didn't have a lecture on it?
We did. It was
Kind of.
No.
Some of it was split in the posterior triangle, and then there was comments about the superior ganglion when we were talking about different things, but there was
It
never
not really
clearly as an individual
Pathway.
subject.
that we,
Gotcha.
but we didn't do, like,
It was
when,
like piecemeal, it was like a little bit here, a little bit
Yeah.
here, in different days and.
in different days and different
didn't-
lectures,
Different
there was never,
So now,
Yeah.
if you look back on it, you can try to over